Welcome back. Welcome back. This is the People's Voice. I am Trey Evans, and I am the People's Voice. Thank you again for checking out the podcast this week. As always, it is greatly appreciated. As always, we thank everyone who has taken some time and listened to the podcast today. We do understand that you could be utilizing your time to do something else. So we are appreciative that you're taking that time to spend with us. As always, if this information is valuable and you find this to be enlightening or worth sharing, we ask that you subscribe to the podcast and then turn on notifications. That way you will be notified when each episode is released. And we do put out a new episode each and every Friday, which is heard on all podcast platforms. And then we also put a video out on YouTube as well for those who would like to watch the podcast. But in any event, we say welcome and welcome to the People's Voice podcast. So today, I want to get into a topic that I covered previously, but I recently saw a story that was done by CBS News and CBS Mornings. And this story was covering dialysis centers here in the United States. And in their reporting, they very much focused on, two aspects of dialysis centers here in the United States. They were talking about not only the cost and the amount of profit that these centers are bringing in, but they were also talking about some of the deplorable conditions that many of these dialysis centers operate under, with very little oversight. And so I want to talk about that today. I want to talk about it also because I felt like, and I don't know if, this is going to be a continuing investigation by CBS News, but I think one of the things that was missing from that piece was the highlight about where these dialysis centers are located. Because I talked about this probably a year, maybe a year and a half ago, about the overwhelming number of dialysis centers that are located in Black neighborhoods and lower income neighborhoods. And I thought that was a piece that I would have liked to see them explore as well. But obviously I know, they had, their own set of parameters for their investigation. But let me go back to something that I said, again, a year and a half ago on the People's Voice podcast when I talked about dialysis centers in Black neighborhoods. Let me play that, and then I'll go further on, and we'll talk about the CBS News piece. But this is from me about a year or so ago, talking about dialysis centers in Black neighborhoods.
And it's estimated that there's almost 7,000, over 7,000 dialysis centers here in the United States. And a large majority of these dialysis centers are in Black and brown neighborhoods. And even though, and as I've reported before in other stories, even though Black Americans, people of color, only make up 13% of the population, we are still the amongst the highest in terms of needing and seeking treatment for kidney disease.
And that was, again, about a year and a half, almost 2 years ago, where I talked about this issue. And so the other day, of course, I see this pop up on my timeline, and I'm like, wow, this is insane. The fact that they're now covering this in terms of the proliferation of these dialysis centers, because literally there are almost I think it's like 500,000 people that are currently using these dialysis centers. But in addition, there are basically two companies that provide this service, and I believe that they merged at some point, but DaVita and Fresenius are the two companies or organizations that provide these in-center dialysis for kidney patients or for patients that require dialysis. And it is literally a conglomerate in terms of the market share. I believe they have somewhere between 70 to 80% of the market share for these services. And so when you start talking about market share, you're just talking about money. And, you know,
men lie, women lie, the numbers don't.
So this is not just because I think sometimes it's masked in, oh, we are providing a service, you know, almost in a sort of a hero mentality. No, this is a business, and many aspects of this business is predatory, in my opinion, especially when you start talking about healthcare, racism, and things of that nature, which I've covered. But in the CBS piece, like I said, they talked about this. So in their piece, they did a 7-month investigation to look into the dialysis center. I mean, the dialysis industry, to discuss again some of the conditions and also their profit motives. And so I want to play a couple of pieces from their reporting, and then I'll go on from there. But this is some CBS News investigation where they talked about this very topic during their 7-month investigation. So let me play a piece of this, and then I'll jump back into the rest of the podcast.
Performance standards. Now, as Aaron Moriarty reports, there's a push to rein in the companies that dominate the market.
53-year-old Jeff Park relies on a home dialysis machine to do what his kidneys no longer can, remove waste and excess fluids from his blood.
Could you live without having that treatment?
No, I would die within 3 days.
More than 500,000 Americans are on dialysis, and until 2021, Park, like most of them, received what he and others call fast food dialysis at clinics run by for-profit corporations like DaVita and Fresenius.
They're interested in keeping the revenue streams flowing, moving us in like cattle. You get that patient out, get the next patient in. You'd sometimes find blood stains still on the armrest, sometimes in the chair, blood stains in front of you on the floor that no one's been able to clean up because they're too busy.
Now, Fresenius is the DaVita and Fresenius. But as you heard from the gentleman and from that reporting, fast food of healthcare services, because literally it is a meat market. And if you if you live in a neighborhood, or if you drive into neighborhoods, and you can pull this up yourself, this is not some conspiracy theory. You can just Google DaVita or Google Fresenius to see where one is located by your neighborhood or within driving distance of where you live. You will drive by and you will literally see people coming in and out all day. But oversight of this industry has been lacking for a number of years. And as a result of that, people are not only receiving poor treatment, but they're also being exposed to higher risk of death because of these treatments. And these are assumptions. I don't want to make this, these are opinions, excuse me, based on some of the reporting that I have looked up myself, and also some of the reporting from this piece. But let me play a little bit more of this piece from CBS News, and then I'll go on from there. But they did a great job in terms
Our
of
CBS
reporting.
News investigation found that since 2013, dialysis centers have been cited by federal regulators for more than 115,000 deficiencies, including poor training and unsanitary conditions. Around 67% of those deficiencies were split between clinics reported to be owned by DaVita or Fresenius.
And again, those are the two largest players in this particular industry. and of obviously generate the most revenue out of those two. Just so you know, the two companies themselves serve over 200,000 daily dialysis patients in the U.S. every year. It says that they both also operate clinics worldwide, but with such power comes scrutiny. And so that's why a lot of these companies are now receiving this type of scrutiny, especially in this type of reporting from CBS News. In terms of the amount of money that's being generated, I wanted to get into that as well, because that's, some of the key components here on why CBS News is doing this reporting, not just because of the conditions, but also the money that they're making. So let me take a quick break, and then I'll come back with the amount of money that is being made by these two companies. My name is Trey Evans, and this is The People's Voice. We'll be back. Welcome back. So, as I said, the revenue that's being generated by these companies is the main goal that obviously these companies are aspiring to. They often mask it in, we're providing a service and we want to help society and the residents or the patients that are dealing with end-stage kidney disease. But this is very much a business, and business is always first at hand. I'm looking at a report from Macro Trends where they analyze various companies, and I'll just pull it up here. So it's been reported that in 2024, DaVita generated $12.81 billion in 2024. In 2023, they did $12.14 billion. And then the year before that, in 2022, they did $11 billion, $11.6 billion. So this is very much a business, and this is what's driving this, as the gentleman said there, this fast food model, if you will, of dialysis treatment that is being provided to so many patients across the country. Just to get back into it a little bit more in terms of the race disparities, because again, that was something that I felt that the reporting did not cover. In terms of the race disparities, research consistently has shown, and I talked about this again in previous podcasts, that Black and Hispanic Americans as well are more likely to experience higher rates of kidney disease and often face worse outcomes. Now, a lot of this also has to do with how the structure in terms of testing and reporting is done. I actually talked about this as well, not to keep going back to things that I talked about, but I talked about this in terms of how this is reported. As a matter of fact, in that same piece, and I'm trying to pull it up as I'm talking to you guys, I talked about Dr. Ian Smith, talked about how there was a disparity in how these tests were done, which ultimately were leading to individuals having to be diagnosed or being diagnosed with kidney disease or having to go on to dialysis. Matter of fact, let me play that, and then I'll go on from there. But this is from, again, the People's Voice podcast about a year and a half ago.
Break this down, and very confusing to a lot of people.
Sure.
You have a situation where let's call EGFR a block. And if you have 2 blocks of EGF, if EGFR is representing 2 blocks, you have 2 blocks in your blood, that is considered to be normal for a white person. For a black person, they found, most black people actually have 4 blocks normally in their blood. So a white person with 2 blocks, a black person with 4 blocks. They're both considered to be normal because blacks just normally tend to have a higher amount. Based on that supposition, they then made a scale and said that your EGFR is not going to put you on a donor list because it's not low enough for African Americans, whereas if they were white, it would be low enough. And it's this discrepancy, this assumption, let me just say, that's making it not fair to a lot of African American patients and could be deadly for some.
And that was, again, Dr. Ian Smith, and he was on a show called The Doctors at the time where he talked about why the disparity is with so many African Americans specifically not being able to receive kidney transplants and then being basically cattle progged, if you will, towards going to these dialysis centers, which again use this information to project revenues and are using individuals basically to make money. But in certain studies, and I'm just reading here, in certain studies have found that black patients, for instance, are 4 times more likely to require dialysis compared to white patients, but it doesn't stop there. African Americans and Hispanic patients are also more likely to experience delays in starting dialysis, which can result in worse health outcomes. Now, some of the studies say that the reasons for the disparities are complex, but as you heard Dr. Ian Smith explain, a lot of it has to do with that reporting that he was referring to, and also, testing methods as well, because it is a huge problem that is occurring in this country and has been going on for decades. Matter of fact, I'm going to play one more piece here from the CBS News report, because again, a lot of information that's not being discussed, but I wanted to make sure that we got it out there today. So this is from CBS News.
Corporations, and where critics say the treatment is designed to maximize company profits over patients' needs.
This is fast food dialysis, if you will. One size fits all, in and out as quick as possible. And how's our stock price doing?
Tom Mueller is the author of How to Make a Killing, an investigation of the dialysis industry, currently dominated by for-profit corporations, resulting, he says, in not just higher costs, but also among the highest mortality rates.
In America, patients on dialysis die 1 to 2 times faster than in any other developed country.
Now, the question I raise, is this America?
And this is America, because in America,
Men lie, women lie, the numbers don't.
and that's what's driving many of these decisions in the dialysis industry and in healthcare overall here in the United States. So that's what I wanted to talk about today. Like I said, I saw this story from CBS News, and I said I got to jump on this because there needs to be more reporting. I think, first of all, CBS News did a great job, so let me go ahead and give you that, because any exposure to this is great exposure. Like I said, there is another component to it that I wish they would have examined, which is the race component, but that's what my task is, right? To kind of give that information that I feel is not getting the necessary coverage, and then put it out there, and then hopefully you take that information and duplicate it by sharing it with your network, family, and community. But that's my time for today. So if you want to leave a comment, you can reach me at the People's Voice Podcast on Instagram, and then you can also reach me at the I Am Trey Evans on YouTube. Of course, I'll post this video, and any comments that you want to leave, please feel free to do so, and of course I'll respond. But as always, dreams are not just for sleeping. Please wake up and live your dreams. My name is Trey Evans, the People's Voice. Tell somebody about the dream. Salute.
I am Trey Evans.